Thank you all for joining this debate. I am Ashraf Virmani. I am scientific and medical affairs research person from Alpha Sigma Netherlands. We are very privileged to have with us Professor Rossella Napi and Professor Alessandro Genesani. So we will have some questions and answers regarding sexuality and fertility. Important themes and important questions here still. Both Rossella and Alessandro are very well known and researchers in this field. So let's see what kind of questions we have. So I have some questions here already. Can I start with Alessandro? So the first question I have is for Alessandro. Now, cortisol is decreased in stress-induced amenorrhea, especially in patients that undergo some kind of integrative treatment, like, for example, carnitines, arginine, and N-acetylcysteine. And this is also important in PCOS. Now, what is your comment about cortisol in PCOS? This was a question.
Oh, thank you, Dr. Ashraf. This is a really interesting aspect and issue, since cortisol is really involved in stress-induced diseases, both when you are very lean or both when you have, let's say, PCOS. That's it, when you have obesity and when overweight is something which is really stressing you. So on one side, it's how to say, a different face of the same aspect, since cortisol is really inducing some impairment in the neuroendocrine control when you eat not so much or you are really stressed due to physical activity. But on the other side, cortisol is activated or hyperactivated when you are stressed, being infertile, being overweight, being with aesthetic problems, similarly to what is happening in PCOS. So the incredible strange thing is that in both cases, cortisol is activated as also gluconeogenic hormone. So on the side of being lean and with hypothalamic amenorrhea, you have somehow the production of glucose. But on the field of the PCOS patient, you have an exaggerated amount of glucose produced, since PCOS have hyperinsulinemia, usually higher glucose levels, and excretion of cortisol in a higher amount is creating a more severe aspect on this field.
Indeed. Okay.
Integrative treatment might be the approach in both cases.
Okay, good. Thank you, Alessandro. By the way, Alessandro is from the University of Modena, I forgot to mention. And now I will ask to Professor Rossella Napi from University of Pavia, sorry. So Rossella, you are doing a lot of research in sexuality, and in particular, you have a lot of work on female sexual dysfunction. One of the questions that we all have is how much of the sexuality issue is psychological and how much is organic, how much is really related to biology per se. Maybe they are both the same things, I don't know, but what is your comment?
Thank you for this interesting question. As you know, this story is the chicken and egg story in our clinical practice, meaning that there is always a need to be well balanced when you face a sexual symptom. You have to rule out all the organic factors that can be involved. But for sure, there is a strong body-mind connection, meaning, let's say, if you have a low desire, this can give you, for example, depression as well. If you are depressed, sooner or later, you will develop low desire. Therefore, we have really to identify which factors we can correct easily. Let's say we have an hormonal issue there, you enter menopause, you are on the pill, we try to figure out if we can improve the hormonal environment of women. But at the same time, we really need to understand if over time, the symptom has some kind of consequence, for example, in the relationship, and therefore you have to address also this issue. The complexity of dealing with a female sexual dysfunction is there, you know, and this is one of the reasons why sometimes healthcare providers, they don't break the ice with their patient because they are afraid to open the Pandora box. But at least as physicians, we really need to try to restore the orgasmic background, the organic background that is favoring the sexual response from desire to lubrication to orgasm. And after that, if we were not able to fix it, we go on trying to understand what's going on in the emotional and cognitive aspect of the sexual response.
Just following on from that, Rosella, you know, because also you have written on this, there is a lot of problems starting around menopause, right? Normally. Now, the premenopausal, there is a, let's say the problem is starting and you can start to treat it. But what about when you're postmenopausal? What can we do for this type of women?
As you know, when you enter menopause, you have a big hormonal challenge. There is a significant decline of estrogen, and women, they start facing a lot of symptoms also related to the androgen deficiencies. You know, androgen deficiency is mostly due to the passage of age. So it's due to the aging process. And therefore, when a woman, she enters menopause, she has already half of the androgen than when she was 20 or 30. So, however, what I believe that the hormones are playing a very important role, but also we have to pay attention to other dimensions of women well-being, fatigue, overstress, poor sleep. They all contribute to the clinical expression of female sexual dysfunction. So, of course, in symptomatic women, we have to propose hormonal treatment, but we have also to consider other complementary treatment that can help women to face the challenge of this big change in their life. So restoring energy and implementing other aspects of their well-being is as well important. And also we have to think about that usually these women, they already suffer from a female sexual dysfunction during the premenopausal period. So, in my opinion, to have the best management of female sexual dysfunction should start really in women over 40, when they are already premenopausal, and we try to modulate either with hormone or non-hormonal treatment, supplements, vitamins, and herbal remedies. They can help when the symptoms are mild during the transition, and we can go on and better follow our patient in the perimenopausal trajectory.
Okay, thank you, Rosella. In fact, you know, this brings me very nicely to also this questions to Alessandro, because you have studied a lot hypothalamic amenorrhea, which is stress related. And, you know, here again, you know, women also with other disorders like PCOS somehow are linked to this type of problem. So would you like to comment something about this, the stress factor in this?
Well,
Issue?
the main issue due to stress is something which is related to a very subjective way to respond to what is considered a stress. I mean, if just a rock is falling close to me, probably because I'm used to have rocks and stones all around me, I'm very fond of geology.
Yes.
I have no fear at all, but someone else might be scared for such kind of event. So the biology can respond to such strange environmental situations in a completely different manner. So we can say that both in case of PCOS as well as in hypothalamic amenorrhea, the hyperactivation of the, how to say, defensive systems in which cortisol plays a relevant role is able to affect also the reproductive activity. If a stress is happening just once in a while, or if a stressor is happening every 2 hours or 10 times in a day, such stressors are able to activate defensive systems who are able to impair the reproductive ability as well as other functions in our biology. So on one side, in some specific situations, the presence or the absence of specific nutrients, which are usually found in the food, but some persons might not have them because the habits are completely different, might not have such kind of nutritions that are able to improve or help in the defensive way that the biology is trying to apply to, how to say, counteract to stress. And that's why we have tested the use of such kind specific integration in so completely different situations, such as stress-induced amenorrhea and PCOS. You have seen the manuscript that our group made together with Professor Malchegalski in Poland. And in both groups, we have tested in patients with stress and amenorrhea, as well as in PCOS, and the same integrations with carnitines, N-acetylcysteine, and L-arginine, we are able to face and improve on one side the metabolic impairments, on the other one the reproductive impairments, reestablishing in both groups of completely different patients the ability to recover the reproductive functions and in the same time the metabolic impairments. So this gives a clear idea that our biology is really clinically and biologically based on metabolism. And metabolism and reproduction are tightly linked one with the other one.
Yes, that's a very good point. I think Rosella made a similar point, no, that you were saying the sexuality also tends to worsen with nutritional deficiencies, micronutrient deficiencies, aging,
Absolutely.
all these kind of factors. I think, you know, one of the strategies may be also to confront the deficiencies, let's say, in the metabolism and improve the energy, as you mentioned before, both of you. And in a sense, we are also fighting the aging process, I guess, isn't it? There is an underlying issue in there somewhere. But what is your feeling about the aging-related loss of sexuality? Is it true, or is it just a myth that, you know, there is a deeper...
Do you want to have my ideas, my feelings? Well, I think that aging is something related to the evolution of the biology of each single subject. So if you are able to maintain your biology in a good state, so you have good nutrition, you are not really pushing too much on your stress-induced damages, you can survive to whatever, and your life might be 100 years long.
Oh, yes.
Yeah, we have to consider anyway that sexual function is a function of the body. So if the body is aging, the mind is aging, you have less stamina to spend energy for sexual function, exactly as you have less energy to run or to do whatever. So we have to consider sexuality an expression of well-being throughout aging. And even though maybe your performance, of course, are not as you when you were young, but you can keep on going, maintaining a satisfactory sexual life if you feel in good physical and mental shape. So this is my message, really, that we really need to be well, you know, and we have to work for the wellness of our patient, and we can protect also their own sexuality by doing that.
Yeah, thank you. Alessandro, do you wish to add anything else?
Oh, I absolutely agree on this. And I think that the aging processes are something which are really related on our lifestyle. it's absolutely affected on your genetic or other biological predisposition that you might have. But if we are facing somehow and we have the chances to overcome the environmental factors, we might really improve the aging of our brain, since if we protect the brain from being damaged by the ongoing of years, we probably can face in an absolutely good way menopause in the field of female, how to say, coping, and in male coping.
Indeed.
So these are fundamental, absolutely. So
Absolutely.
the right choice of nutritions and lifestyle and integrations might really of good health. Absolutely. Remember that in the Western societies, food is not the best item that we are, how to say, using to improve our survival. So we have to
Well,
think a little bit on this.
yes. Thank you. Thank you, both of you. You know, it's been a really interesting debate, and I have really good feedback from you, and hope to see you again soon in person.